Thursday at 11 a.m. East African Time. Right now, let me welcome Dr. John, who is the Director of the Africa Centers for Disease Control and Prevention, for his usual Thursday morning briefing on the COVID-19 situation. Dr. John, you have the floor.
Thank you, Wayne, and a very good morning to everyone and the colleagues that are on this platform, the media, the journalists, and others who have joined. As usual, we will start with the epidemiological update and then discuss what Africa CDC is doing, and we'll end up this first part on COVID-19 with the vaccine update, which I know it is of great interest to many. So let me start with the epidemiological update. As of 9 a.m. East African time today, the world has, as we know, that the numbers continue to increase, but I'll just focus in Africa, that we have reported over 3.8 million COVID-19 cases. That accounts for about 3.5% of the total global number. The recoveries are around 89%, very good recovery. That is about 3.4 million people that were infected have recovered in Africa. The total deaths today stand at about 102,000, and to be very specific, 102,470 cases of individuals who have died. Unfortunately, our case fatality rate is now at around 2.7%, slightly up from 2.6% the previous week. Now, if you look at the continent and we look at the number of countries that are accounting for about 66% of the caseloads, they include South Africa, representing 39% of the overall case loads on the continent, Morocco 13%, Tunisia 6%, Egypt 5%, and Ethiopia 4%. So let me just dwell a little bit on the case fatality ratio. And the global, just to put it in context, the global case fatality ratio is 2.2%. However, if you look at our continent, 38% of our member states, representing 21 countries, are reporting a case fatality ratio of above 2.2%. And I will not list them all because, again, 21 countries in that category. So that suggests that even though our trends are coming down, as I'll discuss later, the number of people dying, of course, has increased and actually exceeded the global case fatality ratio. So just a word on the variants. 9 member states have now reported the B117 variant, and they include DRC, Gabon, Gambia, Ghana, Morocco, Nigeria, Senegal, and South Africa. Again, I will leave it at the B11 variant. And as Africa CDC, we take an exception in labeling variants to any country. 10 member states have reported the variant, the B1351, and they include the Botswana, Comoros, DRC, Gambia, Ghana, Kenya, Malawi, Mozambique, South Africa, and Zambia. In terms of the changes, if we compare the week last week, which is the epidemiological week 6, and the current week, which is the epidemiological week 7, we observe the following trends in terms of new cases. Overall, 74,000 new cases have been reported across the continent. The highest proportion of these new cases, representing 39%, are from Southern Africa, 22% from Northern Africa, 19% from West Africa, 15% from East Africa, and 5% from Central Africa. The following 5 countries are reported the highest number of new cases over this last week. South Africa with 11,000 cases, Nigeria 5,800 cases, Ethiopia 5,700 cases, Tunisia 5,300 cases, and Mozambique 5,300 cases. If you now look at the number of deaths, that is over the last week, we've recorded a total of 2,786 new deaths across the continent. And this represents a 19% decrease from the previous week. If we now look at the last 4 weeks, that is the week between January 25th and February 21st, we observe an overall average decrease across the continent of 19%. And these decreases translate in the regions, the 5 regions, as follows: 27% decrease in Southern Africa, 17% decrease in Northern Africa, 9% decrease in Western Africa. However, a 6% increase in Eastern Africa and 2% increase in Central Africa. If we now look at our most populous countries across the continent, South Africa has observed an average of 36% decrease, Nigeria 15% average decrease, Egypt 4% average decrease. However, Ethiopia has now observed about 25% average increase, Kenya 14% average increase, and DRC no change. In terms of deaths, over the last 4 weeks, we've observed 18% average decrease in new deaths reported in the continent each week. We now transition to the testing. As a continent, the continent has reported an accumulated number of tests as follows: 34 million tests conducted overall, with a case fatality rate of 11.3%. Over the last week, there was an increase of 12.6% compared to the last week, representing about 915,000 tests reported. 1,000 sequences have been uploaded into the international portal to monitor the circulation of the new variants. In terms of capacity building for Africa CDC, we continue to work with countries to support them on safe vaccination administration in the context of COVID-19. And it will be very important to note that training for COVID-19 vaccination by Africa CDC will be starting very, very soon. And I'll come back to that very shortly. So let me now segue on vaccines, on vaccination. You all recall that a few weeks ago, President Ramaphosa, as the chair of the African Union at that time, announced that AVAC, that is the African Vaccine Acquisition Task Team, had secured about 270 million doses of vaccines. It is my pleasure to let you know that all these doses have been allocated to countries, which means countries have now stepped up and make their requests. We needed to have all of those countries make the allocations, and then the Afrexim Bank will work with them to finalize the contracts, and then the supplies will begin. So that is already a very good progress. And the breakdown, the detailed breakdown, can be made available to you next week. The Africa CDC's regulatory task force has now approved the emergency use listing of 2 versions of the AstraZeneca vaccine, the Oxford vaccine, that is the ones produced in South Korea, and the Serum Institute in India. As I indicated earlier, Africa CDC, in partnership with the HOPE project, will start training on vaccination of 20 countries this week. And then next week, we'll continue to do that both starting in Ethiopia and then in South Africa in the subsequent week. The African Union has endorsed the proposal of the World Trade Organization that could allow countries to choose not to apply or enforce certain types of intellectual property on COVID-19 medical tools during the pandemic. Let me just also announce the good news that the European Union last week announced $120 million contribution to our Africa Vaccine Delivery Alliance to support vaccination rollout. That is the systems that will be required for vaccination, and we are truly grateful for that contribution. You all heard yesterday that and watch on the news that Ghana has received its first consignment of the vaccines, COVID-19 vaccines, and these are from the AstraZeneca shipment from COVAX, and it represents the first nation to have received these vaccines from COVAX. So we are very excited. I mean, about 600,000 doses of vaccines were shipped to Ghana. So that will at least get us started in Ghana, and then we'll keep, hopefully in the coming days, more deliveries will be done. Last week, I did mention that from the AU side, the AVAC, the African Vaccine Acquisition Task Team, will start the distribution, and we are very, very working hard to make sure that, as I indicated, that this week those distributions really start. This week meaning either they start today or tomorrow. And if there are any delays, we really don't project that they will go past the weekend or Sunday. Delays in logistics of moving it around. So the packaging all done, the distribution mapping is done. It's a question of pushing out the logistics there. So we will formally, hopefully before Thursday, we'll issue a press statement to expand on that. Let me, before we open it up or give it back to Wayne, let Dr. Mirawi give you an overview of what the Ebola situation is. As you recall, we are fighting 2 Ebola outbreaks, one in the DRC and one in Guinea. Dr. Mirawi.
Thank you, Director. Good morning, colleagues. I will just give you an overview of what's happening about Ebola outbreak in Africa. Overall, in 2 countries, DR Congo and Guinea, a total of 17 Ebola cases have been reported, with a total of 9 deaths, with case fatality rate of 53%. These outbreaks are not linked, for your information. In general, when we go to DRC, 8 confirmed cases and 4 deaths with case fatality rate of 50% have been reported into health zones in North Kivu. Bena health zone, 5 cases, 4 deaths. Katwa health zone, 2 cases with no deaths. And Musenene health zone is 1 new case reported very recently. So in general, in DR Congo, about, as of today, 956 contacts have been listed. 70% of them, 746 of them are under monitoring, under contact follow-up. 659 eligible contacts have been vaccinated. The DRC Minister of Public Health is working with partners, including Africa CDC, to establish coordination and response mechanism that will help to contain the outbreak as quickly as possible within the epicenter. In the Republic of Congo, 9 cases, 5 confirmed, 4 probable cases were reported, with 5 deaths, with case fatality rate of 56% in 2 regions. It should be noted that last week we reported 6 deaths. The 1 suspected death was returned to be negative lab result. So we have now 5 deaths. 2 cases have recovered and has been discharged from treatment center, one in Conakry and one in Zorokore. To break down by health zones, Conakry reported 1 case, no days, and this case has already recovered. And Zorokore, 8 cases reported, 5 days, 1 already recovered and discharged. In general, the response in Guinea is, as of today, 382 contacts have been registered, of which 106 completed their follow-up and 276 are currently under follow-up. Over 11,300 vaccine doses have been delivered to the Republic of Guinea, and vaccination officially began on Tuesday, 23rd February. As of today, 51 eligible individuals have been vaccinated, 11 are in Conakry and 40 in Zorokore. The screening is in place at ports of entry, and investigation for the origin of the outbreak is ongoing with a review of medical records, registration books, and so on. So investigation is still going on to set out the origin of the outbreak. The Africa CDC supported this disease outbreak response. One, we established or activated our emergency operations center to manage or support, coordinate both disease outbreaks in DR Congo and Guinea. Our field team, advanced team in Guinea, is working closely with different partners and with the Ministry of Health to develop the National Emergency Response Support Plan. And also they identified the needs and gaps currently, and we here at HQ, from the preliminary report from the field team, developed our emergency response support plan for the whole region. So saying that as Africa CDC, we put forward as a guidance, at this time, the Africa CDC recommended the following to member states to enhance their cross-border surveillance across the region, map population movement to identify all potential crossing points where there is a risk of disease spread, set up a screening posts and conduct health screening for travelers with signs, symptoms of EVD and Ebola and so on. Implement public health measures at border screening points, including temperature monitoring, infection prevention and control, and share information. Information is really vital to curb this outbreak, and we need across borders. We recommend member states to share information across the region. Thank you. Back to you, Director.
So, Wayne, thank you, and over to you.
Thank you very much, Doctors John and Merawi, for those really comprehensive briefings on the two epidemics that we're fighting, the COVID-19 and the Ebola outbreak. Now we are at the time when we take the questions from the media, and the first one is coming from Deborah Matabu. And Deborah says, I'm a reporter at the Sunday Mail newspaper, a weekly paper in Zimbabwe. And the question that she has, she says, how many African countries have started COVID-19 vaccinations, and which vaccines are they using?
So, thank you for that question. First of all, let's celebrate the good news yesterday about the vaccines arriving Ghana from the COVAX facility. And the importance of that is that I've stated many times that COVAX represents a symbol of cooperation and global solidarity that we have always talked about. I think that has to be recognized. This in challenging times, like what we're dealing with, this pandemic now for the past close to 1 year and now 2 months almost, every little step in the right direction should be celebrated. So we really are happy with that. So with that said, which countries have started vaccination? Let me start from the south and move upwards slowly. A journey of 1,000 miles begins with one step. And the few steps that we are doing will hopefully add up in this pandemic. And we hope that in the course of this journey, we accelerate that accelerate this so that we can be ahead of the pandemic. So South Africa has started vaccinations with Johnson & Johnson. You saw President Ramaphosa take the vaccine live. And then when you move up to West Africa, we now know that Senegal started vaccinating with the vaccines from China. Ghana received their vaccines yesterday, and hopefully they should start vaccination today. And then you move up north, you get Morocco and Egypt that have started vaccinating mainly with the vaccines from China. And then we also know, if you go eastward, that Seychelles had been vaccinating with the vaccine from China. I think those are the countries that are known. Now, Guinea, earlier on, we know that we did some very early vaccinations with about 60 people with a Russian vaccine. We have not heard more from that vaccination program. And it is safe to leave it at that. We, Africa CDC, will be establishing a comprehensive mapping of who is vaccinating where and with which vaccine, so that you can each time go onto their website, click there and see how the continent is flooding. But again, as I said, let's celebrate these early steps. The vaccine situation scenario, we've all discussed it on this platform over and over, how challenging it is, the efforts that we are all doing. And I'm very pleased, personally pleased, to see that some of the movements have started.
All right, thank you. We go now to Eswatini, and we are joined by Bonisile Makubu from the Times of Eswatini. And she says, last week, His Majesty King Mswati III told the nation that he survived COVID-19 after using remdesivir, which he got from Taiwan. He then commissioned the government.
All right, the briefing by the Africa CDC there, giving us some numbers with regards to the coronavirus on the continent. Over 3.8 million cumulative cases on the continent. Fatalities are over 102,000, and this translates to a 2.7% case fatality rate, which is slightly, we're told, above from the slightly more from the previous week. South Africa, as you heard, accounts for 39% of the overall caseload on the continent. We also got an update with regards to the Ebola situation on the continent. But with regards to vaccines, the Africa CDC Regulatory Task Force has now approved the emergency use listing of 2 versions of the AstraZeneca Oxford vaccine. And this is the ones produced in South Korea, as well as the Serum Institute of India. So that's the very latest. We're going to keep a close ear on that briefing. We'll bring you some of the big headlines a little later on. There's a live briefing happening now